안녕하세요. 행사 시작 전 잠시
Good afternoon, ladies and gentlemen. Some housekeeping announcements before we begin.
attention, please. The second forum, Strategy for Developing Medical Career Academy E-class, will begin online and offline at 3 p.m. During the event, we kindly ask that all participants remain seated and have their phones on vibrate or mute mode. Online participation in this event may be accessed through the Medical Career official YouTube channel. Once concluded, the event may be reviewed via Medical Career Academy official YouTube channel or Medical Career official website. Simultaneous interpretation services will be available in both Korean and English. For Korean, please channel number 7. And for English, please click channel number 8. Once again, for Korean, please click channel number 7. For English, please click channel number 8. Thank you for your cooperation. 잠시 안내 방송 드리겠습니다. Ladies and gentlemen, may I have your attention please? The second forum, Strategy for Developing Medical Career Academy E-class, will begin online and offline at 3 p.m. During the event, we kindly ask that all participants remain seated and have their phones on vibrate or mute mode. Online participating in this event may be accessed through Medical Career Academy official YouTube channel. Simultaneous interpretation services will be available in both Korean and English. For Korean, please click channel number 7. For English, please click channel number 8. Thank you for your cooperation. Good afternoon. I'm so delighted to declare that the second forum of Medical Korea has commenced. The title of this forum is Strategies for Developing Medical Korea Academy E-Class. My name is Lena Park from the Global Healthcare PR team of KIDI, and I've been granted the honor of being the MC of this forum. We'd like to warmly welcome everyone joining us today. The official event has been organized by the Ministry of Health and Welfare of Korea and Korea Health Industry Development Institute in order to introduce Medical Korea Academy E-Class and to seek strategy for expanding and promoting these classes. We will hear about the curricula from the top experts who develop and design, as well as first-hand experiences from trainees who have previously participated in MKA E-Class. Afterwards, we will seek the strategy to consistently expand and to promote MKA E-Class through the panel discussion. Now, let me briefly introduce the distinguished guests and speakers. When I call each name, please welcome them with a warm round of applause. First, the Executive Director, Kim Young-ok, is participating in this forum. Now, let me introduce the professor who developed and designed the curricula. Professor Kim Sung-gun from Catholic University of Korea, Yeouido St. Mary Hospital. Professor Gong Sung-ho from Seoul National University Hospital. Professor Lee Jin-suk from Chungbuk National University Hospital. Professor Lee Ho-young from Seoul National University Bundang Hospital. Professor Han Hui-jong from Graduate School of Public Health, Yonsei University Hospital. Thank you. Lastly, let me introduce the trainee who previously participated in the MKA E-Class themselves. Dr. Aryunbol Dorgoto from Mongolian Darkhan District General Hospital. Mr. Muhammadorif Turusboyev from Republican Research Center of Emergency Medicine are participating. Thank you. The Executive Director of KIDI, Kim Young-ok, will now deliver welcoming remarks. Please welcome him with a big round of applause.
Hello, ladies and gentlemen. I'm the Executive Director of KHIDI. We are here to discuss ways to better improve our MKA E-Class, and that is why we have decided to host this forum. I believe that it is quite significant that we are hosting this forum at this particular moment in time, and I'm very pleased to be here. I would like to thank the VIPs who are in attendance today, who have taken time out of their very busy schedules to work very much for our training program. Our clinical professors have come here. They have participated in providing the courses to our trainees. And we also have trainees who have come all the way from Mongolia and Uzbekistan to be here. They have participated in the MKA E-Class. We do have 2 doctors with us today. The KHIDI has worked very hard to provide training and other educational content to doctors, physicians, and medical professionals overseas. And in the 2000s, we saw COVID-19, particularly in 2020, and that was a time for us to come up with online courses, shift most of our courses online. And we have seen many improvements, and we've also been able to diversify many of our educational offerings to our trainees. And Going forward, I do hope that this is going to be an opportunity for us to be more active in participating and providing even more content to trainees. And today in this forum, if you can discuss various strategies for us to make that happen, that will be helpful. And the discussions today will be reflected in our actual policies. We do provide online programs, as I mentioned before, but we also provide various training programs offline as well. The offline and online programs, when they are provided together and the trainees can participate in them both, I believe that that is going to lead to a synergy effect. Today, we are going to focus more on the strategies to better improve the online training programs. We can talk about the training courses at large. I do hope that we can have active discussions on how best to improve our content. Along with the KEMAS event, Medical Korea 2023 is being held together, and there are various forums that are provided along with this. There's KEMAS and Medical Korea 2023 that are all going on simultaneously. So after today's forum is over, I would like to invite you to participate in the other events that are going on here so that perhaps you can also take a look at how much the medical devices industry in Korea, that market, has also grown and developed recently. We also have many guests from overseas. I do hope that you can have this time to take a look at how much the Korean medical industry and our medical devices industry have grown. And if you have any questions, you can take this opportunity to have your questions answered. I would like to thank everyone who has worked so tirelessly to organize this event, and also to Park Hyo-rim, Lena Park, who is our host today. Please give her a big hand. She is really truly a master in designing training courses and training programs. She has committed herself to these efforts, and I believe that in the future, we did see a kind of a change in our organization at KHIDI. We have renamed a team called Training Team. This is how much we are committed to developing further training programs and training courses to try to make them more world-class and more improved going forward. Because we have those organizational resources in place, I hope that she's going to invest herself more in those efforts. And I wish you all health and happiness. Thank you very much.
Thank you. Now on to our first presentation, the introduction of MKA E-Class. The speaker, Lee Arum, is a researcher with a global healthcare PR team of KIDI. Will be highlighting the status of MKA E-Class as well as their operating plan. Please welcome her with a warm round of applause.
안녕하십니까?
Good day, ladies and gentlemen. I am Lee Arum, researcher at the Global Healthcare PR team at KIDI, in charge of MKE class. And let me now give you an overall presentation on the current status and the plans for this program. The Medical Korea Academy E-class started its pilot program in 2020 in response to COVID-19, and it provides an online training course for many medical professionals around the world that do not have to come necessarily to Korea to receive this online course. The MKE class involves a total of 10 courses, including both clinical and non-clinical. In the case of the clinical, it includes surgical skill course of hepatobiliary and pancreatic surgery, gastrointestinal surgery, colorectal surgery, breast and thyroid surgery, and trauma and surgical critical care skills. And for internal medicine skills, we have infection control skills, echocardiology skill, and endoscopic skills. And for non-clinical, we have medical ICT education and hospital management education. It has a total of 20 to 25 hours throughout a 5-day course, and it will take place 2 times per year for 2023, and I will go into the details afterwards in the latter part of my presentation. Each courses consists of videos by the top-notch professors in Korea, and once you enjoy the video and you've finished the course, KIDI will issue a certificate of completion. And the certificate would be issued per course, so you can actually get multiple certificates after enrolling in multiple courses. And in terms of the application, you can go into the MKE class website, input your personal information, and select the courses that you wish to enjoy. In 2023, it will take place 2 times per year. The very first course will receive applications in June, take place in July and August. And for the second session, we will receive applications in September, and it will take place, the online training course will take place in October and November. And for those that are interested, please give us your email address, and we will make sure to provide you with the application-related information for both June and September when we open for application. Let me now move on to some key achievements. We started our pilot program in 2020, and for multiple years we have had many physicians, nurses, medical system professionals, and government officials benefit from this program. For 3 years, from 45 countries, a total of 486 professionals were trained through 919 courses. This indicates the top 6 countries with the most number of program alumni, which starts off with Mongolia, Vietnam, India, Ukraine, Russia, and China. In terms of top curriculum with the most number of program alumni, you can see that it's in the order of gastrointestinal, hepatobiliary and pancreatic, infection control, medical ICT, colorectal, eco, and endoscopy, and breast and thyroid. Let me now move on to some strategies to further develop the MKAE class. It's true that we have many trainees around the world, but I do want to mention that we do have the top partner countries that you've seen in the statistics, and what we want to do is put in place an online interactive channel or live seminars to actually promote their participation. And not only that, many PR channels can be utilizing the channels of associations, medical journals, as well as the media. And what we want to do is build a network with our partner countries, and then within the CME type of system, we're thinking of offering credit grants to the trainees and discuss this with the relevant governments. So that was a brief summary on the MKE class training program in 2023. I truly hope that many medical professionals take part in the MKE class, and I hope you can benefit from the program. And not only that, I do know that there may be specific foundations, associations, and institutions that are interested in these overseas medical professional education. So I would like to ask for your utmost interest and outreach and promotion. And we have a brief PR video for you to enjoy. And with that, let me conclude my presentation. Thank you.
As you are probably aware, Korea is known worldwide for its advanced medical system. But what may be less known is that you can receive clinical training from some of Korea's top medical professionals, and without ever leaving your home. Here at MKAE Class, Virtual Campus, you can attend dozens of classes featuring faculty members of leading Korean medical schools and hospitals. MKAE Class is a distance learning platform created by our experienced team as the highest educational value available to international trainees, but also with convenience and flexibility of the user in mind. Since its inception in 2020, the program welcomed more than 486 medical practitioners from 45 countries, many of whom have praised Korea's fine health education and cutting-edge medical technologies. Our medical courses are designed to build a firm foundation for advancing practical knowledge and technical skills. The subjects include surgical skill education, internal medicine skill education, and non-clinical education. Every year, we have added several new courses in response to emerging needs. Each course consists of approximately 20 lectures. During and at the end of each course, trainees are given quizzes and exams which they must pass. Upon passing of the final examination, trainees will earn a certificate of completion provided by the MKA. When you register for a course, you will be able to enjoy benefits of Korea's high-quality medical education. Why don't you have a test drive?
Welcome to Medical Korea Academy e-class.
Check out upcoming course offerings and register to learn by going to mka-eclass.or.kr. If you are a medical practitioner who is passionate about your career and eager to take it to the next level, you have found the right place at MKA eClass. Everyone deserves a quality education. Hope to see you soon.
Thank you. Please set a reminder for yourself to pay more attention to the program schedule of 2023 MKA E-Class. Next, we are privileged to present to you the dedicated professor who developed the curricular themselves. During this special event, they will be sharing the specific content of each courses. Gastrointestinal surgery skill education is one of the major MKE classes. Let's hear the detail from the Professor Kong Sung-ho from Seoul National University Hospital. Please help me warmly welcome him.
어떻게 넘겨? 다음 거. 아, 요걸로요? 그건 없고요. 저기는 뭐 커서 같은 건 없고. Thank you very much for a kind introduction. So, I was asked to present about the MKA online course, especially for the gastrointestinal surgery program and some of the recent updates in treatment of gastric cancer as well. So I'm also the member of a Korean surgical skills study group, and which have over the 300 surgeons to educate our surgical resident, and this group initiated and then continued the surgical resident hands-on education program for a long time now. And fortunately, the MKA gave us a very good opportunity to collaborate to develop this online program. So this group, we could develop the 8 courses, including the basic course and then the advanced course of the hepatobiliary and pancreatic surgery and gastrointestinal surgery and colorectal surgery, and the breast and thyroid, as well as trauma and surgical intensive care. So today I want to introduce the gastrointestinal surgery program, including basic course and advanced course. So each course has a 5 days course, and on each day, 2 to 5 lectures are there. So we invited the most skillful surgeons from Korea, all over the Korea. So because Korea is the most famous about the gastric cancer surgery, we assigned some subjects about the gastric cancer surgery in a significant portion of the course. So the first day of the basic course, we started from some overview of principles and current practice and even the future perspective by Professor Han Kwang-yang, who is the founder of the Korean Surgical Scale Study Group. And also we started from the very basic skills of a laparoscopic procedure, such as a suture and tying, and also how to deal with the medical devices, and even the endoscopy and endoscopic dissection. And second day, we dealt with the most frequently performed gastrectomy, which are the distal gastrectomy and total gastrectomy, how to dissect and how to resect the stomach, and how to reconstruct and put the bowel together after resection of the stomach. And third day, we also dealt with the function preservation surgery. The most representing function preserving surgery is a pylorus preserving gastrectomy and also proximal gastrectomy. And even the surgeries for the far advanced cancers, which requires a quite extended surgery, which not only resect the stomach, but also sometimes a spleen or a pancreas or other adjacent organs. And also there's some palliative surgeries for the unresectable stage 4 cancer. And day 4, we put some interesting subjects about the new technologies, such as image-guided surgery or the robotic surgery, and some associated new technologies. And also, the submucosal tumor or subepithelial tumor is a very interesting subject. Sometimes it is easy, but sometimes it requires some interesting the tips for the resection. And peptic ulcer is another very frequent disease other than gastric cancer that the gastrointestinal surgeon encounter in their practice. So we put the subject in here too. Day 5 is a last day, and also the anti-reflux surgery for the gastroesophageal reflux disease, and the bariatric metabolic disease is the type of surgery that the upper GI surgeons are doing a lot. So we put those subjects in the last day, and also for the hands-on clinical hands-on training, we often use some animal model such as pig or even cadaver. But the anatomy of the pig is quite different from the humans, so we introduced the anatomy and some tips for some hands-on training. Those were the basic course, and from now on the details of the advanced course. Advanced course is for some doctors or the medical experts who experienced a little bit about the gastrectomy or the upper GI surgery. So first day is for the esophageal surgery and G-junction cancer, either by the thoracic approach or the abdominal approach. And day 2 is for some surgery of difficult situation. For the remnant gastric cancer means that new cancers are arising in the remaining stomach after the gastrectomy, which is a little bit difficult because of some adhesion of previous operation. And also some patient who underwent some other operation previously. And duodenal tumor is one of the very difficult one to dissect and resect. And day 3 is some more detailed surgical procedure, such as intracorporeal anastomosis. That means that make an anastomosis in the body, and some details of a robotic gastrectomy and reduced port surgery, which means that usually we use 4 or 5 the trocar or pores, but the reduced the port gastrectomy uses only the 1 to 3 ports, so it is technically a little bit more demanding. So we put them in the advanced course. Day 4 is for how to deal with some complication or emergent cases, such as bleeding or the adhesion or internal herniation for emergency situation, and some more advanced skill of intraoperative gastroscopy for sentinel node navigation or the hybrid surgery using both laparoscopic and endoscopy. Day 5 is also for the bariatric metabolic surgery. And also the upper GI surgeons frequently see the patient of hernia too, so that we put some programs of hernia surgery, including inguinal hernia and the ventral hernia. So those were the details of the program, and this is a very short summary of MK online program in 2022. As introduced, there was a 2 period from July to September and October and November. And the number of the trainees who completed the courses was 67, but the number of people who registered the course was over 400. So even though not everyone completed the program, we hope and we believe that many of them might have had a benefit from partially, at least something from the course. So the MKA course also surveyed the trainee about the satisfaction with the 11 questions about the many aspects, and the average score of satisfaction was quite high, over 94% for both the basic and advanced course. I highlighted the most highly satisfied lectures with the red colors. And I was impressed that they were satisfied not only the courses in the basic course, but also programs in the advanced course. So second part is a recent update in treatment of gastric cancers, which is quite difficult to explain in a very limited time, but I can summarize that there were some changes of indication of endoscopic resection and some result of an important randomized clinical trial about the laparoscopic surgery or the function-preserving surgery came. And recently there are increasing interest about the neoadjuvant chemotherapy or the various situation of stage 4 cancer, and there are many updates in systemic therapy, including immuno-oncology drugs and target therapy. So instead of explain all the things, I want to introduce the updated Korean practice guidelines for gastric cancer, which was published by the Korean Gastric Cancer Society. So Korean Gastric Cancer Society published a practice guideline of gastric cancer in 2018. So after 4 years, we published the updated guidelines. So a previous one had 23 statements, but the new guidelines have the 40 statements. You can see the list of the all the statements in the earlier part of the guidelines, and you can see the associated relevant flow chart in the second row. So we provide about 6 algorithm flow chart that you can easily see and find. So compared to the previous guideline, we subdivided as M1 disease or the unresectable disease, depending on the situation, such as we separated unresectable M0, including the pancreas head invasion with the real M1 cancer, and some treatment for the gastric outlet obstruction, or the single organ oligometastasis, or the limited peritoneal metastasis, and even some conversion surgery, even though there are not enough evidence accumulated so far. And the endoscopic treatment, some significant changes for this the red box, which was called the expanded criteria for the endoscopic resection previously. Previously, the endoscopic resection was not strongly recommended for this criteria, but in this updated version, we recommended the endoscopic dissection strongly, in addition to the gastrectomy. We both recommend the endoscopic resection and the gastrectomy. And we also dealt with left lower part of portion, which is written as a lateral margin positive, which means that the patient who underwent the endoscopic dissection and fulfilled all the criteria of a complete resection, but has some remaining tumor in the horizontal lateral margin. So we suggest some option a little bit weakly, re-ASD instead of a surgery. And also we put the recommendation of a Helicobacter pylori eradication after ESD. And this is for the surgical treatment. And we reflected some important studies of a Korean group. Senorita is for the sentinel node navigation surgery. And class 4 and class 5 is, as I mentioned before, is for the function-preserving surgery or reduced surgery. The class 4 is for the pylorus-preserving gastrectomy, and class 5 is for the proximal gastrectomy. And the long-term result of class 1 and 2 also came published, which is the RCT comparing laparoscopic versus open surgery for early gastric cancer and advanced gastric cancer. And we also dealt with how to obtain the R0 resection and how deal with the patient with R1 resection. And separately, the adenocarcinoma near G junction was there in the separate flow chart. And we mentioned about lower mediastinal lymph node dissection. And there were significant updates in the palliative systemic therapy. Notably, the nivolumab, the immuno-oncology drug, was included in the important treatment strategies for the first-line palliative chemotherapy. Ramucirumab and plus paclitaxel was added as a preferred regimen for the palliative second-line treatment. And other drugs, and especially trastuzumab deruxtecan for HER2-positive treatment, was included in the palliative third-line therapy. And I will skip. So you can download them from the website of the Korean Gastric Cancer Association or JGC online. So maybe it's 70 pages of a very long guidelines, and you can get the information from there. And I was very happy to have an opportunity to prepare and implement all the online the videos, lectures with the MKA and the Korean Surgical Study Group. And I hope that we also invite many persons, and then so that we can educate them in person in our hospital too. Thank you very much for your attention.
Thank you for the informative speech, Professor Kong. MKA consistently introduced new curricula for E-classes, in particular surgical clinical care skills every year. In 2022, it offers a newly developed trauma and surgical critical care skill course. Let's hear the detail from the professor who was dedicated to develop the entire program, Professor Lee Jin-seok. Please welcome him with a warm round of applause.
Thank you for introducing me. I am Professor Jin-seok Lee from the Trauma Center of Chungbuk National University Hospital. I am pleased to have the opportunity to introduce the trauma and surgical critical module. This presentation includes the purpose, composition, key point, difficulty in producing, and our desired topic for the advanced course. The goal of this video lecture is follows: to help you understand and apply the principle of initial evaluation and resuscitation for patients with multiple or severe trauma, to help you learn about methods for airway evaluation and related procedure, to help you understand how to evaluate chest injury and learn basic surgical skills necessary for treatment, to help you understand how to evaluate abdomen and pelvic injury and learn the necessary basic skills for surgery, to help you acquire the basic knowledge and skills necessary for providing surgical intensive care. This lecture video are made up of 5 different parts: primary survey and resuscitation for multiple or severe trauma, airway and ventilatory management, thoracic trauma, abdomen and pelvic trauma, and bedside procedure, and ICU management. I'll give you a full breakdown of the important stuff. On the first day of the lecture series, there are 4 classes covering the following topics: initial patient assessment and management, damage control resuscitation, blood replacement, and usage of hemostatic agent, and focused assessment with sonography trauma. The first class will focus on primary survey method for severe trauma patients during their first visit, which is based on the airway, breathing, circulation, disability, and exposure. In this class, we will also discuss the possible problems that may arise and how to treat them. In the second class, we will introduce the concept of damage control resuscitation and demonstrate how to apply it. During the third class, we will explain the definition of massive bleeding and related complications. In addition, we will discuss the action mechanism of topical agent and treatment method for applying them. In the last past lecture, we will explain what PAST is, its limitation, and how to perform the procedure. On the second day, we will focus on airway and ventilatory management. The lecture covering following topics: decision-making regarding the need for definite airway, airway management, intubation, include rapid sequence intubation, and surgical airway, such as cricothyrotomy, tracheostomy. During the lecture, we explained the indication for intubation, what constitutes a difficult airway, the basic technique for intubation, and the concept of rapid sequence intubation. We will also provide instruction on how to perform RSI according to the procedure. In the remaining lecture, we will explain the anatomy and method for performing surgical airway. This will enable you to perform the procedure. On the third day, we focus on chest trauma. The lecture covers following topics: assessment and management of thoracic injury, needle decompression, chest insertion, chest tube insertion, resuscitative thoracotomy, and pericardiocentesis. During the lecture, we explain important anatomical structure of chest and initial assessment of patient with chest injury. We explain the method and precaution for performing thoracotomy and needle decompression, which are frequently performed in emergency situation for critically injured patients. We also explain the indication, method, and precautions for resuscitative thoracotomy and pericardiocentesis, and we demonstrate the procedural step for resuscitative thoracotomy and pericardiocentesis that enable you to perform this surgery. The lecture first day is about abdomen and pelvic injury. The lecture will cover the following topics: assessment and management for abdomen injury, damage control surgery, temporary abdomen closure, assessment and management for pelvic injury, temporary fixation for unstable pelvis, and peritoneal pelvic picking. In this video, I will aim to explain the important anatomical structure of abdomen and pelvis, and the type of injury, their corresponding treatment protocols. We explain the concept of damage control surgery and various kinds of temporary abdomen closure, including how to perform this procedure. Regarding pelvic injury, we will help you understand the indication and method of temporary fixation and pre-peritoneal pelvic packing, which are frequently performed in patients with pelvic fracture. The last day training video focused on bedside procedure and ICU management. This video covered the following topics: arterial line insertion, central catheter insertion, mechanical ventilator, and hemodynamic monitoring. This video about catheterization covered the basic concept and technique of inserting arterial and central catheter were explained, along with their respective indication and contraindications. We also demonstrated the use of ultrasound guidance during catheterization. In the mechanical ventilator video, we explained the indication for mechanical ventilation, different type of mechanical ventilation, and how to adjust the setting so that educated surgeon can control mechanical ventilation independently. The hemodynamic monitoring video discussed the importance of monitoring hemodynamics and various methods for measuring and interpreting hemodynamic parameters. The video helps you identify the volume status of the patient and make a clinical decision based on the hemodynamic data. We faced several challenges while creating this video lecture. First, determining the appropriate level of education was difficult because we had no information about the medical environment, training system, and the level of surgeon who would be watching this video. Second, language was a major hurdle because most of team members involved in creating this module were not fluent in English. Lastly, due to the unique characteristic of trauma and surgical critical patient, capturing a video of real-life patient was difficult. I think that creating advanced course related to trauma and surgical critical care would be quite challenging. However, if we were to develop such a course, we would like to produce video lecture that cover the surgical method for subdivided organ injury, complications that may arise during the surgery or procedure, and advanced use of equipment in intensive care unit for critically patients. Finally, I hope that many surgeons from various countries watch this educational video and they can improve their surgical skills through this educational video. Thank you. Thank you for attention.
Thank you, Professor Lee. Actually, now we are providing with simultaneous interpretation services will be available right now. The Korean is channel number 7, English is channel number 8. In addition to surgical courses, MKA also offer non-clinical e-classes reflecting the demand of overseas medical trainees. So we are going to hear the specifics of medical ICT from Professor Lee Ho-young at Seoul National University Bundang Hospital. Please welcome him with a big round of applause.
Thank you for nice introductions. It is honored to prepare this ICT program in MKE class, and also it is very honored today that introduce this program to many foreign and domestic participants. Okay. Seoul National University Bundang Hospital is one of the leading ICT healthcare hospital in globally well known. So due to those kind of a brand of our hospital, I think I get a chance to prepare this program. I will shortly introduce our program. And before starting the introductions, SNUBH has been opened in 2003. It was a worldwide first full digital general hospital. And today is 2023, so this year is the 20th anniversary of our SNUBH opening. So we will have some kind of a program in May 12. If you have interest, we will also send some kind of a program. For ICT healthcare, I think it's not easily to understand for the doctor and nurses because it's a little bit technical field, but well known, and some of the doctors and even the nurse are when I met, they are have a deep understanding of this field. But anyway, most of the users are just for using this kind of a program for their medical activity, not deeply understanding or deeply have a question about this field. But anyway, to improve those kind of understanding of this ICT healthcare program, we made it this prepared this program for the to reduce the burden of the program. This is a 1 week, 5 days program, and we have a 5 to 4 hours to not to bother the participants' weekend lifestyles. For the 5 field, we have a lower-end function of ICT in healthcare. ICT is the information and communication technology. And second day is for introducing of an electrical medical record field. And the third day is for utilizing of big data and AI in healthcare. Actually, recently, some kind of a GPT is very introduced globally about AI in not only in the healthcare field, but also in other engineering, and also covering other fields. The fourth day is for the concept of precision medicine initiative in Korea. And the last day is for understanding of IoT and 5G mobile applications. So SNUPH have providing those kind of lecture content, and KIDI has been managing this kind of education program. This is a program overview. To prepare this globally updated high-level lecture, we gather all the special experts in Korea, and I will introduce each lecturer in the next slide. For healthcare and ICT, the lecturer is Hwang Hee. He's the Kakao Healthcare CEO now, actually the senior CIO of SNUPH. He has been successfully built up the Best Care 2.0, is one of the well-using HIS, Hospital Information System in Korea, not only in Korea, but also in Mid-East and even in the United States. Some hospitals are using this Best Care 2.0. And actually, in first of the January of this year, the Japanese hospital has been started using Best Care 2.0. And he moved to the Kakao Healthcare last year in 2022, so he is still actively working in the healthcare business field. The second lecturer is Im Gun Chon. He's the president of Korea Health Information Service. So he is introducing some kind of a healthcare ICT policy of Korean government. Actually, the ICT healthcare field in Korea is a little bit different with the other countries because most of the HIS or EMR system has been started from the hospital or private company. Comparing with the United States, actually, the United has been driving those kind of force from the government. So government gave it many funded to the medical institute to use the HIS, and they have in some kind of a government rule which has to be followed if you wanted to do the business in United States using the HIS to improve those kind of interoperability between the medical institute. But in Korea, we have been starting from the institute and hospital and also company. So we have a little bit lack of the interoperability field. So government has been made this Korea Health Information Service office, and they are recently building some kind of a government rule for interoperability and basic function, which the HI has been gathered. So this kind of a policy is very important to improve our ICT healthcare field in Korea. For the understanding of EMR, the first lecturer is me. Actually, I'm a CIO of Seoul National University Bundang Hospital from 2016. So I will introduce some basic function of the EMR. Actually, many doctors and nurses thinking that EMR, most of the function is to improve the efficiency of the doctor and nurses' work. But actually, that is a half is correct and the other half is incorrect, because EMR, one of the principle of the EMR is the users they have to follow some kind of a principle of the medicine field, like a patient check or making a record on the responsibility from the doctors and nurses. those kind of a principle should not be broken by end user requirement. And the second lecturer is Yu Soo-young. She is a professor of SNUPH and expert of the medical bioinformatics and EMR field. She will introduce some kind of a strategy for EMR function and introductions. And for the understanding of EMR, the first lecturer is Park Hyun-hye. She is a professor of Seoul National University College of Nursing. She is one of the best experts for standard language mapping kind of a SNUMA city, one of the globally using the standard language. And the second lecturer is Park Yu-rang. She is also one of the experts of ICT field, and she is a professor of Yonsei University. She will introduce the concept of common data model and use cases. Common data model is one of the consortium global activity to making each database of each institute follow some kind of a common rules. If you build your database in your hospital, follow this kind of a CDM rules, you could cooperate with inside the consortium, not only in Korea, but also the foreign institute to using the big data, because all the data has been mapping with the standard rule of the CDM consortium. So it is easily, you could expand those kind of your research field using the big data. And also for big data and AI, the first lecturer is Kim Young-hak. He is a professor of Asan Medical Center, and he's also one of the best experts for big data research and also cardiologist. And he's also head of the Health Innovation Big Data Center of Asan Medical Center. He will lecture about the concept and trends in big data and AI. And second lecturer is Kim Hyun-jun. He is the CEO of Vuno, one of the famous company in Korea for AI healthcare service. So he will be a lecturer about domestic use case of AI technology, which some of the solution has been developed by Vuno company under the support from the government project, like a Dr. Answer 1.0. The third lecturer is Kim Douglas. He's the CEO of Infinity Healthcare. Infinity is a famous PACS company in Korea, and also is well known in the foreign countries. And he will lecture about the utilization and approach of big data, mostly focus on the imaging data in the hospital. And for the IoT and 5G field, the first lecturer is Kim Dae-jin. He is a professor of the Catholic University of Korea, and also the CIO of St. Mary Hospital, and also he is a vice president of the HIS company. And he will lecture about the understanding mobile application regarding IoT and 5G. So actually, I think many doctors, nurses, and also patients and the patient's family are using many kinds of the wearable devices, like a Galaxy Watch or some Apple Watch. So this kind of wearable devices could be used for gathering some kind of a life flow data to hospital. Actually, in SNUBH, we have some program, IT service, that the wearable devices which is used by the patients could be connected through our PHR app, and those kind of data will be gathered in our hospital server, and also doctor could be see their patients or how they are doing activity in their home, not only visiting their home, or patients visit the outpatient clinic. So most of the chronic disease might be needed those kind of service to give much more close and accurate clinic management of disease management for patients. And the second lecturer is Jae-ho Lee. He's a professor of Seoul Asan Medical Center. He is also one of the experts about the ICT healthcare field, and he will lecture about the use cases of a mobile application in clinical setting, mostly for emergency disease. And for the precision medical informations, Actually, many doctors and scientists, even in government members, think that the precision medicine is kind of a important field for the genetic information. But actually, I understand the precision medicine is one of the ways that the medicine is art to transform to the science, because precision medicine is not only covering the genetic information, it's covering the whole data which we develop using your daytimes. So gather those kind of a data will be much more deeply understand how could we prevent the disease and treat the disease, because many things we doesn't know. Actually, doctor doesn't really know about the answer of questions from the patients. So we will get some gathering the both kind of a base of the data, we could find some kind of answer for the patients. This is the end of the presentation. Thank you for your attention.
Thank you, Professor Lee. With the medical ICT education well underway, MKA next developed their hospital managing course in 2022. Our next dedicated professor is from the Graduate School of Public Health at Yonsei University. He developed the hospital management program of which he will be speaking. Please warmly welcome Professor Han.
Thanks for introducing me, and I'm Hui-Jong Han from Yonsei University, the Graduate School of Public Health. Before starting, I'd like to ask you understanding. Prior to me, every professor is presenting in English, but I guess the KIDI provide the translator, so I'm going to present it in Korean because we need to give the break from to the English-Korean translator, and I believe the Korean-English translator is too boring, so I'm going to give you a chance to translate. So I'm going to speak in Korean. Please understand. 안녕하십니까? 저 연세대학교 보건대학원 한휘종입니다.
Good day, ladies and gentlemen. As introduced, I am Han Hui-jong, Research Professor and Chair at the Graduate School of Public Health at Yonsei University. Today, I would like to talk about a particular course on hospital management by Medical Korea Academy. As was mentioned by the other speakers, the course or the curriculum consists of a clinical course and non-clinical courses, and the non-clinical courses include the medical ICT education that was just presented. So it has not been uploaded as of yet, but in 2023, we're also going to add another module on hospital management education.
Receiver, the only foreign participant, you have to use the receiver, and I think it's a dial number 8. Is that right? Yes, dial number 8. 2023년 올해.
So starting from this year of 2023, the MKA program is going to add a hospital management education module. So I would like to give you some more information on this very course. This slide is on Medical Korea Academy E-Class program, and already researcher Adam has given us some detailed information on this, so I don't want to be redundant. I will go and move on. So first of all, if we go into the hospital management education of Medical Korea Academy, once again, it's going to open in 2023, and this will be hosted by the Korea Society of Hospital Management. We will have professors from universities and also those in charge of management at hospitals that would be coming together to create this training program. So if we first look into the purpose of this course, as you all know, we're seeing a rapid change in the hospital management environment. So in such an environment, it's important to make sure that we can run and manage the hospital in an efficient and effective fashion. So there are specific methodologies that can help. So if you look at hospital management, there's also a strategic management component that comes into play. So way back, the strategic hospital management concept was already introduced in Korea. I'm sure that for those of you that work at the hospitals probably know what I mean. So If we think about hospital management and hospital strategic management, I can say that Korea's level in this regard is quite high because the hospital management environment in Korea is quite different from other countries. It's mostly private led. So the hospital management related techniques and a variety of techniques have been introduced quite early on. So then why do we need hospital management education or HME? As already mentioned, we're seeing a rapidly changing environment because of these rapid changes. It's true that we can no longer stick to business as usual. In the past, hospitals really didn't have that concept of management or strategy. It was more about the necessity of a long-term plan. If we think about running a business, hospital was just that it was an institution where they did not necessarily have to market or attract patients. If they were good, if they were professional in their skills, you just had patients coming in. But now it's different. They have to go out and promote themselves and market themselves to attract patients. And hospitals do have to pursue profit, but if we ask, is it easy to be profitable as a hospital? Well, then, if we ask that question, many people would say that, well, in Korea, because it's mostly private-led, you have to pursue profit. It's a profit-oriented organization. However, in Korea, hospitals are categorized by law as not-for-profit. However, because you're not-for-profit doesn't mean that you have to pursue profitability, because you need to make a profit, and only with that profit or revenue can you reinvest in your services to provide even better quality of care. So the hospitals in developing countries would say that hospitals are in the public sphere and it's government led, and they may ask, is profit important? However, if that's the case, healthcare expenditure will only increase. Sometimes the hospitals may think that we do not need these management techniques because the government is out there to have their back. However, that's not the right approach, because at the end of the day, it will just bring up the healthcare expenditure of the population. Here you can see two words, effectiveness and efficiency. If you think about a hospital, it's not just about effectiveness. It was more about efficiency at the hospitals. And if you think about profitability or profit taking, what would we have to do if we think about companies that sell products or those that sell their services, these private-led companies? For them to be profitable, what do they have to do? There are two things that would have to be done. One would be to sell as many products and services as possible, and the second way is to cut costs. However, the hospital of selling more products and offering more services, this is not something that the hospitals can control completely, because it's very difficult to forecast the demand in an accurate fashion. So how did hospitals pursue a profit? It was more about cutting costs to be profitable. But if you cut costs and continuously cut costs, you come to that point where there's no more costs to cut. In other words, you're faced with the wall or limitation. So that's why many people would say that fee of service needs to be rationalized, that the overall revenue structure has to change, and that hospitals need to be able to pursue profit programs. And I think that this is not just a challenge in Korea. As was mentioned, developing countries, and if we look at other public hospitals around the world, you do need to stay in the black in order to reinvest and to provide quality care. And quality care basically means that it will help the government reduce their healthcare expenditure. And a hospital is a place where various professional groups come together. We have the medical professionals, the doctors, the physicians, the nurses, and the administrators, the managers, and the technicians. There are various professional groups that come together and work together. And because of that, there are a lot of interests intertwined within this organization. So what kind of HR management is conducted is also a key aspect to managing a hospital. And then about performance management. in the past, and even now, we talk about MBO, which has to do with managing objectives. These days, hospitals also utilize this concept of MBO, which stands for Management by Objectives. So it's true that this concept was out there. It was probably in the 50s when it was first introduced. And after MBO, we've seen the advent of KPIs, or Key Performance Indicators. And recently, we now see the rise of objectives and key results, or OKR. This is also a major trend these days. So MBO was first, and then we had KPIs, and recently we've been seeing OKRs. But in Korea, it was quite different. It was first KPI, and then it was MBO. And so KPI was just a brief fad, and then it was the MBOs. And recently, we're seeing more companies introducing the OKR concept, especially manufacturing companies. So this, in terms of the order, was slightly different in Korea versus other countries. But at any rate, what's important is that hospitals and organizations started to manage their performance. And this is also a key aspect to strategic management. And last but not least, what's most important is about performance evaluation and feedback. So what kind of assessments and evaluations are ready, and how will the results actually be fed back into the organization to improve? So this all has to do with strategic management. And if we look into our HME program, it consists of 5 major themes. As you can see here, we have leadership, and then we have the organization and management, and the third is finance and accounting, and the fourth is informatization of the hospital, and the fifth is performance management. So the hospital management education module consists of 5 major themes, and within these 5 major themes, it's specified into subtopics, which makes up a total of 25 training courses for this program. So if you think about the MKE class, it's a 5-day course, as was introduced. So yes, it's a 5-day course, and by 5 per theme, one theme per day, basically. That's how the training course is conducted. So it consists of a total of 25 videos, and one video is 30 minutes, more or less. And in the area of hospital management, of course, it's probably the same for clinical, but if you look into hospital management, it consists of so many areas. And to really complete this education with just covering these 5 major themes would not do it justice. But I do want to mention that this is a first attempt, and in hospital management, we just wanted to hit the key points before we do have the luxury to go into specifics. So day 1 is on leadership. Leadership is on the leadership of hospital managers. So it includes the concept of hospital management, the environment of hospital management, the roles of leaders and managers, and human resources management. So day 1 will cover these specified topics, and day 2 is on the structure, the organizational structure and management of the hospital. And the classifications of hospital organizations, the composition of hospitals, and day 3 is on hospital finance and accounting. So it goes into the concepts and principles of hospital finance and accounting, understanding financial statements of the hospital, and also capital raising. So that's day 3. And day 4 is on hospital informatization. It was briefly mentioned in the ICT presentation, where it has to do with CDM, medical information, EMR, OCI, LIS. So relevant topics will be covered. And day 5 is on performance management. So hospital performance management, it goes into the significance of such analysis and how analysis can be done, and evaluation. So that's day 5. And in terms of evaluation, so first is on performance evaluation. It's pretty more or less similar to other courses, where per course there are 2 quiz questions, and per lecture the progress rate has to be at least 85% and above. And then afterwards, there is a completion exam, which has to do with the 25 videos, and it would be a total of 20 questions. And then last but not least would be attendance management. More than 2 days out of the 5 days, if the trainee is absent, then it would be you would have to say that the trainee did not complete the course. So an attendance of at least 3 out of 5 days would be necessary. So this is just one example of what the lecture note looks like, and I'm sure that you all saw the other presentations where we will have English subtitles on the bottom of the video. And then this is how you can register for the course. It was already mentioned by Adam Lee, so let me skip this slide. And as I did briefly mention, the hospital management education course, it includes a variety of topics. So just these 5 major themes cannot cover all of the ins and outs of hospital management. So I hope that we do have the opportunity to go into more specifics in the future. Thank you.
Thank you, Professor Han. Now we will have a special time to hear first-hand experiences from trainees who successfully completed the program's coursework. And in their home country, they are putting their learning into practice. Dr. Arionbold Dorugotov is our next speaker, who comes to us from Mongolia Darken District General Hospital. Please welcome him with a big round of applause.
Hello, ladies and gentlemen. I'm from Mongolia. Mongolians' medical education system and impressions of participating in medical career exam E-class. Information of Mongolia. As of 2031, the population of Mongolia has reached 3,407,739. The average life expectancy in 2021 is 71 in the whole province, where 107,330 people live in my country. This is my hospital. This is the whole district hospital. There are 10 public services in the whole province, including general hospital is 1, hospital, family hospital is 5, village health center is 3. There are 12 private beds in the province, hospitals in 58, laboratories is 7, disinfection institution is 3, pharmacies in 64. There are 7 drug supply organization and 5 sanatoriums. 1,589 doctors in medical specialists are working in 156 private sector health institutions, and 19% of health workers are senior doctors in 318. And with 78 junior doctors, it's 5%, and nurses and 358%, it's of 30%. Medical specialist is 84, it's 5%, and medical specialist is 170, and it's 10%. Administration staff is 6, and it's of 3%, and 18 or 1% of the specialist. It's in the whole district hospital's information. In my information, I'm young doctor in Mongolia. In every country, doctors strive to improve their professionals' knowledge through continuous research. I'm very happy to know that one of the solutions in medical career exam. My team, I'm working in radiologist doctor in my general hospital and gastrointestinal doctor. And it's my team in 6 doctors and 4 technicals. I'm working computer tomograph, and radiology, and all conferences there. The endoscopy course of the medical curriculum made it very easy to review important information in a very clear way. It was timely and important course. It was very pleasant to read and study and presentations of doctors who are the best in their professions during 2 months. It's my medical curriculum in training pictures. The first picture is with my nurse, and second picture is doing my training lessons, and third picture is in my endoscopy rooms, endoscopy markers, Olympus X-ray retrieved. Medical curriculum training program was very organized. I liked the fact that I could ask the training for the questions I wanted every day of study. And of course, testing provides quality. In my room of endoscopy room, and in my lesson started, my room's airway is not corrected, and I am study of medical curriculum change in my room. It's my hospital's room's instruction. It's a first of this. It's my table, and this room is birth room, and there's patient waiting there. It's my Olympus X-ray tree, and this room is organization of change in my room. This room is disinfection cleanup room. Yeah. This room is ultrasound room. I'm doing ultrasound on patient. One day I'm 15 endoscopy patients and 30 ultrasound and 30 patient advice gastrointestinal take advice. I'm searching early cancer of gastric, abdominal, thyroid, and breast. Gastroendoscopy course finish in my procedures skill level is increased. It's my nurse cleaning in endoscopy. The patient is waiting there. I advise of take patient. Mongolia has the highest stomach and esophageal cancer rates in the world. Middle Korean academy training is necessary to address this problem. It was very interesting to see and study data from developed country from a distance. It is a good and effective way to reinforce that you have learned and apply it to work practice. In the future, I hope that many doctors in Mongolia will receive information about the training. I hope that the doctors of our country will be given a chance. The people of Mongolia will benefit from their doctors receiving training from this program. I'm again telling, the people of Mongolia will benefit from their doctors receiving training from this program. Thank you for attention.
Thank you, Dr. Aryan Boldurgutov. Our next presenter also come from afar and also successfully completed MKA E-class in 2022. Mr. Muhammad Orif Tursunboyev has traveled all the way from Uzbekistan to personally speak to you about the experience with MKA E-class. Please welcome him.
안녕하세요. Hello. Assalamu alaikum. The title of my presentation, Uzbekistan's Medical Education System and Impressions of Participating in MKA E-Class. The medical education system of Uzbekistan begins with two main directions, medical college and academic lyceum. After graduating from this educational institution, candidates will have the right set of circumstances to enter medical universities. This education lasts 6 years. The next level of education takes 2, 3, or 4 years to obtain a master's degree or resident. Stage 4 lasts 2 or 3 years, and it's a golden opportunity to engage in scientific research. Republican Research Center of Emergency Medicine became the main institution of emergency medicine service by the hard works general directors Hajibayev Abduhakim Mominovich and Tuleganov Davron Bakhtiarovich. There are 13 regional branches in all regions of Uzbekistan, providing specialized emergency medicine to the population. It's a multidisciplinary hospital providing urgent medical aid in all main fields of emergency medicine, such as surgical, therapeutic, combustiologic, toxicologic for children and adults. Tashkent Medical Academy is the one advanced medical institution of Uzbekistan. Main idea of the academy, coordination and methodological guidance of higher medical scientific facilities on education, postgraduate education of medical personnel, as well as performing research work in healthcare and public health, shaping healthy lifestyle. My full name is Muhammad Arif Tursunboyev. I am a student of Tashkent Medical Academy and works in Republican Research Center of Emergency Medicine. The most rewarding thing being a medical personnel is making a change in lives of others, whether it helps patients recover more quickly and easily. My role at hospital. I am, as an undergraduate student, can attend to surgical operations which is related to liver and pancreas. Therefore, I have completed the online education course titled MKE Class Surgical Skill Education, Hepatobiliary and Pancreatic Surgery. After this course, I was encouraged with doing laparoscopic cholecystectomy. I have performed this practice with the help of my teacher, Hakimov Avlodkhan Tulkunovich and Hamidov Muhammadkhan Abdugafurkhanovich. As a proof of this, photo of the operation were submitted to MKE class Best Photo Review event and played an important role in winning the competition. For this, I express my deep gratitude to organizers and employees of KHIDE and provides all my support in the future development of this system and its wide promotion in the territory of Uzbekistan. Advantages of MKE class. The first thing I should begin by highlighting the fact is that the MKE class gave me an opportunity to attend in this conference and visit to South Korea. I have learned new surgical operative techniques without problems such as distance, language barrier, etc. During video lectures, anatomical essential fields was explained simultaneously. Studying in this program, I could learn how to work with laparoscope and endoscope rationally. Lectures based on real clinical situations, thus they was very easy to understand. What should we do to develop MKE class in Uzbekistan? First of all, we should add some studying hours or credits, signature, and name of director to certificate. In Uzbekistan, doctors training programs award with certificate of completion. The only one thing that difference between certificates is studying hours and second name of director of the organization. Not only in our country, but also in European certificates have been written amount of credits you can see in this slide. Secondly, we should create mobile application. The site is good, but creating new mobile application makes some facility such as uniqueness, user-friendly, rich feature, flawless coding, and powerful marketing. Third, open consult center in Uzbekistan and appoint a dealer. It would be better if we open consult center in Uzbekistan and appoint a representative to give some information about MKA E-class. I have been studied the prevalence of MKE class between medical students. Studying process should be explained and advertised among doctors and medical students in Uzbekistan. I will do my best to develop it in my country. Thank you for your attention.
Thank you, Mr. Muhammadurif Turusmboyev. Yes, once again, please join me in showing our appreciation for their participation in this forum. We'll now take a 15-minute break and we'll continue with the panel discussion promptly at 4:55. Thank you very much. Ladies and gentlemen, may I have your attention, please? At 4:50, we will begin the panel discussion, Strategy for Developing Medical Career Academy E-class. So we will kindly asking all participants to be seated. And just as a friendly reminder, please put your phones on vibrate or mute mode. If you are participating in the event through YouTube, and we are waiting for us to start. We appreciate your patience. Thank you for your cooperation. We will start 4:50. 코리안이 7번, 잉글리시가 8번. 네, 한국어로 하실 거니까 네. Ladies and gentlemen, we'll be start the panel discussion will be start soon. Please have seated. All right, we are now ready to kick off the panel discussion on strategy for developing medical career academy E-class. Let us first introduce and welcome the moderator and panelists. The moderator for today's discussion is Professor Kim Sung-gun. Professor Kim is from the Catholic University of Korea, Yeouido St. Mary Hospital. He is dedicated to the development of the overall surgical critical care skill program. Also, the panelists are all of speakers who gave us presentation earlier. Now, I will turn the microphone over to Professor Kim who will begin and moderate the panel discussion. 교수님 부탁드리겠습니다.
네, 소개 감사합니다.
Thank you very much for the introduction. Hello, ladies and gentlemen. I have just been introduced. I'm Sung-gun Kim. I am at the Catholic University of Korea, Yeouido St. Mary's Hospital. For the past 3 years, I have worked together with the study group on developing the courses for MKAE class. And with that opportunity, I have been asked to lead this discussion, which is a personal honor for me. MKAE class can showcase Korea's medical excellence to the world, and I believe it is an excellent program, and I do have the personal experience of working on it personally for the past 3 years. But in the past presentations, you've seen that I was hoping that maybe about 40,000 people could have participated and maybe about 20,000 people would have graduated with a certificate, but I don't think we have reached that yet, so we have to do more outreach, more promotion. For somebody who is very committed to this program, I really want this program to be well known around the world. With that in mind, I hope that many professors and the trainees can give us good ideas on how we can further grow and develop this program. So I hope to hear your insights in that regard. In developing this course, maybe we have heard the presentations on what they have focused on. I'd like to ask the professors to tell us what their focus was on developing the course, and perhaps you can tell us what was your focus in developing each of the courses. Let's turn now to Professor Kong first. Professor Kim, I think, was more instrumental in actually developing and designing this entire program. So I think that you're the best person suited to this question, to respond to this question. But because you posed a question to me, I would like to respond. In my presentation, I briefly talked about how we try to understand that we don't know which participants from which countries are going to come to the program. So we have offered a variety of courses, starting from basic level to advanced level. And because many participants are particularly interested in the gastrointestinal tract, because Korea is leading authority on stomach cancer and gastrointestinal cancer, so that is why we focused on that. And we also focused on more of practical hands-on training, not just theory. And there are very basic training on skills related to gastrointestinal diseases, but it also scales up all the way to advanced courses. And after the basic courses, in the advanced courses, some experienced medical professionals can come and also learn about some more difficult and more challenging emergency cases. And instead of just looking at cancer, because some countries, the cancer rates might not be as high as they are in other countries, so they might not benefit from just looking at cancer. So that's why we also looked at other relevant diseases, such as hernia or ulcers, and palliative care and different other kinds of bariatric metabolic diseases as well. Thank you.
환자 외상이라는 굉장히
Next, I would like to ask the question to Professor Lee, the same question, who actually put together this very difficult program on trauma and surgical critical care skill. So this year, we took part in this program with our basic course, and that's what's mentioned by Professor Kung. We did not have information on the country, the environment of the trainee, so it was very difficult to decide at what level we should offer our training. So we've actually focused on 2 areas. In the case of trauma patients, at the end of the day, we would make that diagnosis through a CT scan. But when the patient comes in before the scan, it's important to really conduct the right primary survey. So it's on how that should be conducted, and in terms of airway, breathing, and circulation and shock. These are some of the items that we need to identify and then bring about a diagnosis. And when we do identify a specific symptom, there are emergency procedures that have to take place. So that's how we decided to put together our first trauma module. In terms of surgical critical care, when we do encounter patients at the ICU, there are particular equipment and facilities that are most often used, and there are specific procedures, surgical skills that would be required. So we focused on how that can be done and how such equipment can be used. So because this is a basic course, as mentioned, there could be more advanced surgeries or procedures that may be involved. But because this was a basic course, we tried to really be faithful to the fundamentals. Yes, thank you very much.
Next thing, we would like to turn to a professor who was moderating the medical ICT course. Same question, please. Oh, we thought of maybe presenting to CIOs of the different hospitals. And when we worked together with the Ministry of Health and Welfare in Korea, we were able to see that there are many people working in government who are interested in healthcare ICT policy. So those were our primary intended audience. So we tried to offer some knowledge on EMR operations and on how we can make use of ICT to derive clinical value. And when we make use of new technologies, what were some of the challenges that we faced, or maybe some things that we were not able to consider at the time. So we wanted to share this insight with other countries so that when they adopt new IoT and new technologies, that they can do so with a heightened level of awareness so that they would not repeat the same mistakes that we made. So that was the focus of our course. And what's important is that the head of the Healthcare Industry Association, Information Management Association, he, I believe, was very instrumental in providing that kind of healthcare-related data and information to the other participants from other countries. Thank you.
굉장히 많은
Yes, thank you very much. So you put together quality courses for trainees. But you can see that we have the clinical, the skill-related courses, trauma and medical ICT, and we even have a hospital management education module. So you can see that we have these excellent programs that involves the ins and out of the hospitals. So I think that it's important to share ideas as to how to promote these wonderful and comprehensive programs. So what kind of ideas do you have to promote this program? I would like to ask this question to Professor Pi Jong-han. Yes, in facilitating the program, of course, it's important to really have that word of mouth to promote the program. And I do know that you were very successful in promoting the MK up till now. And thanks to your efforts, we've been seeing many medical practitioners from around the world enrolling in the program and completing the program. But if we want to facilitate this program even more, there could be certain marketing activities that we can engage in. If you first think about the trainees that completed the course, I think that it's important to make sure that we continue on in building that network of those that have completed the program. And even in the clinical courses, you can see that most of the courses, because it's still in the fledgling phase, was focused on the basic courses, but I'm pretty sure that there will be some updated courses, advanced courses that would be put together by the experts. It's the same case for non-clinical, not only medical ICT, but as was mentioned, hospital management education is a vast topic. So there are many education modules and topics that can be selected and be included in the curriculum. So for those that have already are part of the alumni and for our new entrants into the program, I think that there are many things that we can do. You can see that if you look at the promotional efforts, there are those that have come as part of a hospital-to-hospital type of relationship program, or it could be through a ODA program, or it could be through an ODA program of where the medical professionals will be dispatched outside to other countries. So Kofi and COEX also have ODA programs. So I think that if we can also make use of these ODA programs to promote MKA, I think that it will help us further facilitate the program. Thank you.
그러면 지금
Thank you very much for that response. I think that because you have said so, that's a great segue into perhaps thinking about not just the promotion and expansion of our courses, but also looking at new offerings. Because even now, every year, we work together, we talk with the trainees, and we listen to the feedback from different associations and societies to try to expand the courses that we offer. So my question to you is, what courses do you think we need to additionally offer through MKA? Perhaps I can go back to Professor Kong and hear your thoughts. Well, I think that because we are so for me, because we offer these surgical technical skills, there's a limit to how much you can actually experience the course just by video and online. So if we talk about developing new courses, I think there's an infinite number of things that we can provide online. But whether it be online or offline, I think that there are some things that are very difficult to teach and very difficult to learn. And by that, I mean emergency surgery. So even within a surgery department, emergency surgery is a very tricky, very complicated skill. So we have to look at different kinds of maybe surgeries that are done in an emergency context. And if we can provide courses on that, that would be helpful, because perhaps this is something that is universal. Emergency surgeries occur in every country, so I think this can help many of our trainees. And if possible, after the courses have been completed, hopefully we can have the trainees implement their skills in person, in real life. And maybe they can also use hands-on training using pigs or cadavers and have that benchmarking. So that means that we can reinforce our online training with that offline training as well. Yes, Professor Lee?
Yes, would you like to add your thoughts? So with regard to trauma patients, if we do put together an advanced course, it should be on septic shock or hemorrhage shock. I think that it would be great if we can have some additional details on how we can manage such patients. And then with regard to surgeries and procedures, if you think about trauma, we have the halobiscus and solid organs, so by organ. There could be interventions and surgeries that can be involved. So I think such training can be offered in our advanced course for trauma and surgical critical care patients. But as you know, patients are not all ready for this. It's true that we do need a plan, a program in place, and if we're too hasty, it will be a bit difficult. So I think that we really need that time to think through, especially if you think about trauma. It's not like we have elective patients. They're not scheduled. It could be all of a sudden a major trauma with patients all coming in all at once. I'm sure that it may be not very easy to plan. So let me now move on to Professor Lee Ho-young.
So it's similar in scope, but the courses that we have developed thus far have been something that we made, and then we offer to the trainees, and they could choose what they want to listen to. Now, if we look at different countries, they have different contexts, they have different systems, so maybe there is a need to provide courses that are specifically tailored to one individual country. What are your thoughts on that? So I think depending on the area of expertise, that could be helpful. So if we were to go with a demand, customized kind of format, that might be more difficult for Korea to make and develop the courses, but I think ultimately they would be more effective from the part of the user, from the part of the trainees. Before COVID-19, we have received a request from the Ministry of Health and Welfare, and so we did a study on Vladivostok and looked at their healthcare systems, and we also tried to develop a training course for Russia. And so I know that countries are different. They have different demands and different needs, And given their particular situation, they might want some maybe policy-related courses, or maybe some different kinds of courses that are more user-centric. So I think there is a slight difference between the countries. So I think that if we can reflect these kinds of personalized needs in the courses, we can provide courses that are more a good fit with the users, with the trainees. Even now, I think the MKA program is quite good, but I think that we can improve it further. Yes, thank you very much.
프로그램을 보면서
And if we look at the program, we thought that it could be challenging, especially for hospital management education, because the policies, the institutions, the culture, the level of economic development is all different amongst the countries. And we wondered whether we can actually provide or help out the trainees for their benefit. But I thought that it really can help based on the presentation that you have provided. So, Professor Han, if you do introduce a specific course, an added course to MKA, what do you think would really be of benefit for the trainees? Yes, the hospital management education program. When we were putting this together last year, there was a lot of discussions back and forth with Kitty, because the medical system for all of these countries are different. The medical delivery, the compensation, these are all different. So we thought, how can we really have a standardized education module? But we thought that there could be certain areas that are universal. So if we think about the developing states, or there could be specific areas where all countries may be interested. So that's how we decided to put together the program. As I was preparing and presenting on the program, it's the same case for Korea and developing countries and even advanced states. There are some common challenges for all. And one has to do with the increase in healthcare expenditure. If you think about this ordinary healthcare expenditure, this actually is proportionate to the economic development. So you can see that there's no way to actually bring this down. It's just about how we can control the pace of its increase. It's not like we can actually decrease such ordinary healthcare expenditure. However, Korea has been very good at managing this expenditure up till now. So I do want to say that this topic is relevant for not only developing states, but also developed states. And developing states really need to pay attention to this topic, because as the developing states move on to become mid-income countries and advanced states, it's that they witnessed a soaring of this ordinary healthcare expenditure and costs. So as we were preparing for the hospital management education program, we hoped that it can actually benefit in controlling the pace of the increase of such expenditure. And in the future, we would like to touch upon some key aspects, which is universal health coverage, especially an area of interest for developing nations. And there's also SDG, Sustainable Development Goals. These are areas of interest. So we do want to cover these topics going forward in the different courses. There's also patient safety issues and the training of the staff. This is also an area that can be covered by the hospital management education module, and purchasing and procurement, facilities, equipment management, and the disposal of bio-waste, medical waste. This actually can be covered via this hospital management topic. So as we are putting together the lectures, there is the beginner, intermediate, and advanced level courses typically. But if you think about hospital management, I think this is not the most optimal way to go. It's about really identifying the topics that meet the demand of the developing nations. It's to increase the awareness of these many topics. In Korea and in the developed nations, we're very much focused on risk management and disaster preparedness. So when there is a disaster, how the hospital should respond. So these are some areas of key interest of advanced states. But for developing states, this may be something that's not imminent. So I think that such topics, and especially universal health coverage and SDGs, the areas that developing countries may be interested in, I think that should be first, implemented first in our program than the other topics. Yes, thank you. And I hope that Kitty is making note of all of these ideas. And I think that there will be more productive courses going forward.
좀 멀리
So now we'd like to ask some questions to our trainees who have traveled a long way to be with us, and they have participated in our online course, and they have come here to provide us their feedback. Can you tell us which areas were most helpful to you? And also, can you tell us some advice that you can provide to us on how to promote this MKA course in your countries? How can we have more people, more doctors in your countries participate in this program? Maybe we will first of all begin with Dr. Arjunbolt from Mongolia.
It is worth mentioning here that there is no such quality self-development training for doctors in Mongolia. Each lesson covered important topic and provided interesting information from the beginning to the end. Doctors in Mongolia are looking for such training. If such training advertises to the public through the training system, it will definitely be attended.
Thank you very much. 사실은 몽골 아까
We have heard that there's a lot of population centered in Ulaanbaatar. Most hospitals, most facilities, and most professors are there. You are from Dahong. I was wondering if there can be some more meetings in Ulaanbaatar where medical professionals can network with one another, because I know that many Korean doctors fly to Mongolia often, so maybe we can have these networking sessions in Mongolia so that they can promote this course to many doctors in Mongolia.
Thanks. I want to invite Muhammad Orif of Tursunboye from Uzbekistan, the very same question.
So I can definitely say that the MKE class gave me a lot of experience, and the lectures are all very useful and wonderful. And the most amazing thing of my travel was the farm travel, and this gave me an opportunity to enter Samsung Hospital and Asan Medical Center. I must emphasize the one thing is that it was a great honor for me to be invited to the Korea and make a conversation with you. And the education program must cover the other fields of medicine, I think, such as neurology, endocrinology, ophthalmology, and etc. In addition, it would be a great thing if we organize not only online courses, but also offline education programs. This program enables foreign doctors to do short-time practice in South Korea. One of the main difficulties in this stage they face in the process are visa and temporary residence in South Korea. And if we help them to solve this problem, the flow of foreign doctors to South Korea will increase dramatically. And this will be contribute to the development of MKE class organization. Thank you for question.
감사합니다.
Thank you very much. Oh, because we have seen how many online courses can benefit the trainees more if they are coupled together with the offline courses. So along with MKA Academy, the e-courses, I think that this could be a bridge to allowing more people overseas to understand the excellence of the Korean medical system. So we can promote this to more foreign medical professionals to learn about Korea's healthcare system and also expand their understanding of what we can do here in Korea. And in looking at these courses, I was wondering, Because the other doctors here, the Korean professors, have said that they want this and this kind of new course. Maybe to our foreign trainees, is there a course that you want offered in MKI? Again, Dr. Arimunbolt, would you like to begin?
Medical Korea Academy provides excellent geographical information, more hours of the hands-on surgery and trauma courses. I believe that it will be more effective if you choose to practice garden work in your country. I believe that the knowledge of Mongolian doctors about Medical Korea Academy, which will be broadcasted to doctors in Mongolia. Two more information channels will reach an appropriate level.
네, 감사합니다. 이진석 교수님이 좀
Yes, thank you very much. I think that Professor Lee, your work is cut out for you. Maybe you can come up with more trauma courses. There's a lot of exchange between Mongolia and between Korea. I personally have visited Mongolia myself. Along with Professor Young, I have appeared on a television show in Mongolia. If we can have more of these exchanges, with these visits and exchange of opinion, and if we can have more of these networking sessions, then we can expand this course to more medical professionals in Mongolia.
선생님께서도
Yes, Muhammad Orifa, would you like to also answer this question?
The online courses should be provided by MKE class, and we can exchanged program should provided with Tashkent Medical Academy and Republican Research Center. It would be a great change. Thank you.
네, 감사합니다. 여러분들께서 앞으로
Yes, thank you very much. We have heard from you. You've given many different opinions on how we can promote this course even more. So I think that maybe we can just offer Korean offline training to those people who only received MK online training. I think that could be a good way to have more people just come into the MK training. But in any case, I hope that we can have more opportunities offered through MK E-class so that it can be an excellent program that is established to tell more people overseas of the excellence of Korea's healthcare system. Thank you.
네, 감사합니다. 이것으로
Thank you very much. With that, we conclude the panel discussion session, and we will have an appreciation plaque award ceremony. So I'd like to ask you to please remain in your seats.